Welcome to UMCC Medical Consultant Connectors, where your health matters to us. The thyroid gland, a small butterfly-shaped organ located at the base of your neck, plays a crucial role in your overall health. It produces hormones, primarily thyroxine or T4 and triiodothyronine or T3, that regulate your metabolism. These hormones impact a wide range of bodily functions, including heart rate, body temperature, and energy levels. Maintaining a healthy thyroid is essential for overall well-being. When the thyroid gland functions correctly, it releases the right amount of hormones into your bloodstream. However, sometimes things can go wrong, leading to conditions like hypothyroidism, which is an underactive thyroid, or hyperthyroidism, an overactive thyroid. While these conditions are relatively common, thyroid cancer, though less prevalent, can also develop. Thyroid cancer occurs when abnormal cells in the thyroid gland begin to grow uncontrollably. These cancerous cells can form tumors within the thyroid gland, and in some cases, they may spread to other parts of the body. Understanding the causes, symptoms, and treatment options for thyroid cancer is essential for early detection and effective management of the disease. While the exact causes of thyroid cancer remain unclear, several risk factors can increase your chances of developing the disease. These risk factors can be broadly categorized into genetic predisposition and environmental exposures. Genetic predisposition refers to inherited gene mutations that make individuals more susceptible to certain types of cancer, including thyroid cancer. Family history of thyroid cancer, particularly in first-degree relatives, significantly increases your risk. Specific genetic syndromes, such as multiple endocrine neoplasia type 2 or MEN2 and familial adenomatous polyposis or FAP, are also associated with an elevated risk of thyroid cancer. Environmental exposures play a role in thyroid cancer development, with radiation exposure being a significant risk factor. Exposure to high levels of radiation, especially during childhood or adolescence, can damage DNA in thyroid cells, increasing the likelihood of cancerous mutations. Past radiation therapy to the head and neck region for other conditions also raises the risk of thyroid cancer later in life. Iodine deficiency, once a major cause of thyroid problems, is less of a concern in developed countries due to iodized salt. However, in regions with inadequate iodine intake, the thyroid gland may work harder to produce hormones, potentially increasing the risk of cell abnormalities and cancer. Other environmental factors, such as exposure to certain chemicals and pesticides, are being investigated for their potential links to thyroid cancer. Thyroid cancer often develops slowly and may not cause noticeable symptoms in its early stages. As the tumor grows, however, it can press on nearby structures in the neck, leading to various signs and symptoms. One of the most common symptoms of thyroid cancer is a lump or swelling in the front of the neck, often near the Adam's apple. This lump, known as a thyroid nodule, may feel hard or rubbery and move when you swallow. While most thyroid nodules are benign or non-cancerous, it's essential to have any new or growing lump in the neck evaluated by a healthcare professional. Changes in your voice can also signal thyroid cancer, as the tumor can affect the vocal cords or nerves that control their movement. Hoarseness, a persistent cough that isn't related to a cold or allergy, and difficulty swallowing are other potential symptoms. Pain in the neck or throat, though less common, can also occur and should not be ignored. In some cases, thyroid cancer can spread to nearby lymph nodes, causing them to swell. These swollen lymph nodes may feel like small round bumps under the jaw or behind the ears. As the cancer progresses, it can spread to other parts of the body, such as the lungs or bones, leading to symptoms specific to those areas. Diagnosing thyroid cancer involves a combination of physical examination, imaging tests, and laboratory analyses. Your doctor will begin by taking a detailed medical history, including any family history of thyroid problems or cancer. During the physical exam, your doctor will carefully feel your neck to check for any lumps, swelling, or enlarged lymph nodes. They will also listen to your breathing and voice for any abnormalities that might indicate thyroid cancer. Based on the initial assessment, your doctor may recommend further investigations. Imaging tests play a crucial role in visualizing the thyroid gland and detecting any suspicious growths. Ultrasound, a painless procedure that uses sound waves to create images of internal organs, is often the first imaging test performed. It can help determine the size, shape, and characteristics of thyroid nodules, differentiating between solid and cystic, or fluid-filled nodules. A fine needle aspiration biopsy, or FNAB, is often the next step in diagnosing thyroid cancer. During an FNAB, a thin needle is inserted into the thyroid nodule to extract a small sample of cells. These cells are then examined under a microscope by a pathologist to determine if they are cancerous. In some cases, other imaging tests, such as a CT scan or MRI, may be recommended to get a more detailed view of the thyroid gland and surrounding structures. These tests can help determine the extent of the cancer and whether it has spread to nearby lymph nodes or other organs. UMCC, your ultimate medical consultant connectors.